Hi guys, I want to talk to you about something that's really interesting. We are in the middle of an epidemic of calcification of arteries in this country. So as people get osteoporosis, their arteries calcify. A normal, healthy artery pulsates every time the heart beats. And so with that pulsation, the body can regulate its blood pressure. It can get a good pulse wave to extremities. And so you can nourish the whole body. As people age, for various reasons that we're going to talk about in a minute, their arteries can start to get calcified. They get inflammation in the inner wall of the artery, and that inflammation is usually caused by infections or toxins, and it causes an injury, and as part of the healing of that injury, calcium is deposited as part of the scar. This is very close to my heart because my dad was a chronic smoker, and he had a heart bypass when he was in his early 50s. And then he also had calcification in his aorta. And eventually one night his aorta ruptured, and that caused him to die because the artery basically kind of turned into bone, almost like bone. And when it ruptured, there was nothing that could be done. Now we know today that this process is reversible. And one of the things that helps reverse it is vitamin K. Now there have been some very nice studies. Vitamin K is a fat-soluble vitamin. Usually the sources for us are green leafy vegetables, but actually in terms of food sources, the highest source is natto, which is like the Japanese bean, has the actual highest source of vitamin K. But things like broccoli and spinach and kale are good sources, and when they're eaten with fats, the absorption is good. Much of the vitamin K in our body is actually produced by our own gut bacteria. So if you're on medication that destroys gut bacteria, you may not be making enough vitamin K. So this is a really important nutrient, because the way vitamin K works is it keeps the calcium in the bones. 99% of the calcium in the body is in the bones. And we want to keep the calcium in the bones and out of the soft tissues. And when there's adequate vitamin K in the body and in the bones, it stabilizes the calcium within the bones. When the level isn't enough, it can leach out of the bones and can go other places where there is inflammation, both acute and chronic. Now, there's some very interesting studies that were done to look at artery wall stiffness. Like in our office, we have a machine that will measure artery wall stiffness. How compliant are your arteries? Of course, young people have really compliant arteries, and as people age, they tend to stiffen from calcium. And they found that when they supplemented with about 180 micrograms a day of vitamin K, vitamin K comes in many sources, but the ones that we want are vitamin K1 and 4 and 7. And if you get a vitamin K supplement, you want one ideally that has those things in it. So, 1 and 2 and 4 and 7, okay? Because they seem to work the best. And then you want good gut bacteria so that they can also be making your vitamin K. And they found that over a 3-year period that they had about a 5% decrease in the calcium score in the arteries compared to people who didn't supplement with vitamin K, and they had a 1.3% increase in the calcium. So this process can be slowly undone, and I think because of the amount of inflammatory problems there are in bodies today, that it's worth it to supplement with a good vitamin K supplement that's a mixed vitamin K. Now, if you're taking green foods, that helps. Or you're taking green concentrated powders, that helps. Because we're putting in vitamin K in those forms. If you like and want to eat natto, that's good. But taking a vitamin K supplement, I think, is good too. When they tested people, it was 180 micrograms. You'll find these supplements in various places, and I would just look into it. And I think sometimes the K is supplemented or in the same package as a vitamin D, and it seems to me that's a good one. The vitamin D pulls calcium into the bones, the vitamin K keeps it there. So if you have a history of coronary artery disease or hypertension or atherosclerosis or heart valves with calcium, then I would certainly suggest that you supplement with an extra vitamin K, because it will help you to slow this process and actually even reverse this process, and to concentrate in your diet on making sure you're getting plenty of greens and nurture your gut and watch how many antibiotics you take. And for sure, if you're on drugs that block vitamin K, then you have to make sure that you get adequate levels, and you should bring that up to your physician. Okay? So watch your vitamin K. It can really help you, and it can undo the calcium in your arteries. Have a good day.